We are the A2A network. We'd love to win because we are a passionate, innovative and dedicated group of nurses who together harness our joint knowledge and skills to enhance care and save lives of people with learning disabilities.
As learning disability liaison nurses, we work with people across a spectrum of learning disability and autism, from people with mild learning disabilities to those with severe and profound needs, who all access our hospitals with a variety of health presentations. We all work across large trusts with various specialisms and departments. We liaise with colleagues from reception staff to medical consultants and everybody in between. There's a wealth of experience within the network across different bands, but we all have both clinical and strategic responsibilities. We often work as the only learning disability liaison nurse within our trust or within very small teams, and this is why the A2A network is so important. Without the network, we would not be able to continue in our roles due to the intensity and challenges. And more importantly, people with learning disabilities, their families and carers would not get the support that they need.
Well, I'm going to the hospital because when I eat, I feel sick. So the doctor said you have to go to the hospital and have a camera down your mouth, which I wasn't very excited about. I didn't really want to go. I was scared, petrified. I didn't really want to go in the room because I was scared because I didn't know what was happening. And then I met Sarah, the learning disability lady. And the whole time Sarah was there talking to me, calming me down to make sure I was all right. If there wasn't a learning disability nurse there, probably wouldn't even get to where I'm going because I can't read the bits of paper, and when you go to the person at the desk, the reception person, I wouldn't be able to say who I was going to see because I can't remember their names.
Having a network like this enables services to be more uniformed and the care to be sustained in a way that embeds learning disability nursing practice within hospitals to enhance and save lives of people with a learning disability.
The Learning Disabilities Network is just amazing for us parents and carers. It's a lifeline for us.
Connecting to the A2A group for me is vitally important. I mean, for me, I find that I derive peer supervision by coming to the meetings and liaising with colleagues. For instance, at our last meeting, I recall the issue of one-to-one funding for people with learning disabilities in hospital settings being raised as a topic. For me, this is an issue on the ground floor. I sometimes have struggled with this, but to be able to discuss this with peers, it was absolutely amazing because it helped me to get a better understanding as to who I should be approaching for funding and where perhaps the funding should be coming from, and how then that can be utilised to ensure that the pathway of care is safe for the person with learning disability.
At the meetings, we share stories of when things have gone wrong. I find this really beneficial because sometimes you feel, is it just me? Is it just my hospital this happens in? And then you find it's more common and it happens in other people's hospitals as well. And then we're able to bounce ideas off each other and problem solve together, which is really, really helpful for me.
The role can feel really quite isolating at times, which sounds crazy because I sit within a team in a large directorate, but I'm the only learning disability nurse for the trust. When I come across problems or ideas relating to my patient group, I have nobody to turn to. The A2A group is there for virtual support on tap.
I feel the network is really important because of the resources that we can make. It's very difficult to do things as individual trusts. As a whole, A2A is producing a library of short films specific to certain areas of the hospital so that they can be used for training because the issues are very different in all different areas. We have one film already that is used for A&E training. Also in the pipeline, we have one for outpatients, we have one on phlebotomy, we have one for inpatients. These films are online resources. They can be viewed, they're available for everyone.
So the network, I think, is great for me because we share resources. Last week I wanted to easily read information about welcoming back to hospital, and I sent an email to the network I had a couple of responses. I had to pick one from the responses, which was great for me because I didn't have to reinvent the wheel. There was already resources which were already available. So I think the network is fantastic.
The role of the LD liaison nurse is very new in my trust and is in many other trusts. This means that there's no policies or procedures already in place in many trusts around learning disabilities. In my trust, I was recently asked to write the learning disabilities strategy. So what I did was I put out feelers to the A2A network to find out what was already in place.
Not only is attending the A2A meetings really beneficial for me, but outside of that, we as a network stay connected through phone, through social media such as Twitter, and through emails. So despite this being an isolated role, within our group you're never truly isolated, as there is always someone there to support you and we are always connected to one another.
It's great for problem solving because somebody else in the network has always had that problem before, and so you just discuss it and problem solved.
Being part of the network has highlighted just how important the learning disability role is and how transferable our skills are across the acute hospitals.
This has given me the confidence to present a paper to the nursing board in my trust, highlighting the core skills of the learning disability nurse, and for the board to consider employing learning disability nurses in other environments of the hospital, for instance senior health and neurosciences. I'm delighted to say these nurses are now in post.
It's important to have a learning disability nurse in the hospital because people with learning disability need to be able to go into the hospital and be more relaxed, and if there's one there to help you, you'll get through it really easy. And it's very important because the hospital is a very frightening place.
I think A2A should win because it's good to know that there is more than just me, but a wealth of experience and knowledge to tap into.
By being part of the network, we're more confident, more informed, and it's more likely to sustain our motivation.
For me, the A2A network is a great resource for time saving and prevent duplication of work.
The network's a really good forum for sharing good practice to ensure that people with learning disabilities receive the same level of support regardless of which London hospital they attend.
Quite honestly, if it wasn't for them, I don't think my son would be alive. But it's because they're there, and I know that they're only a phone call away. Whenever he's got sick in hospital, they've put everything into place, and the whole network is a voice for our disabled children.